Again, issues that come up with persons with disabilities being victimized. Unfortunately, many agencies that serve victims of violence and abuse are not accessible to people with disabilities. This has come up from time to time again. If you think about a lot of places, I know in the cities I've lived in, Cleveland, Akron, Des Moines, a lot of the shelters created and a lot of these agencies, nonprofit agency, best place to go, older building, somewhere that's available. I worked for a number of years with a group in Des Moines. It was an old building that they used as a homeless shelter, and there were 20 stairs going up to it, and couldn't afford to do anything about it. So that's something that comes up. And also with shelters, emergency situations, unfortunately, things aren't in place. And I think although a lot of these places do have ways to contact them to set something up outside the shelter, it creates a nice and I think protective atmosphere where somebody can go in and they feel a little bit more confidential. And in regards to personal care attendants, I know you had a note, Jacqueline.
I just wanted to say that another issue of people going to shelters is they need to have attendant care. They don't just need a ramp necessarily to go in. They also need a roll-in shower possibly, raised toilet, different things like that. Of course, we're talking about people with physical disabilities when we're talking about physical access. But program access as well. What happens if I'm deaf? Are interpreters going to be available for me? Things of that nature. A lot of times brochures, the initial stuff that's disseminated to let people know, aren't necessarily in accessible formats. What if I'm blind or low vision? I may need enlarged text in brochures, braille brochures, different ways to let people know about the programs as well as the physical barriers.
And I think Jacqueline brings up a good point. Communication is key to these pieces. And in not only shelters, also emergency rooms. I know of one case where a woman who was, she spoke a very, unspoken language. Not many people in the world spoke a language, and she was separated from her family and went to a hospital. They couldn't understand her, and they automatically thought she had a psychological impairment, put her into a shelter. Nobody could communicate with her. And it was a couple years before somebody happened to realize this was as a native language to very south of Mexico, very rural area, and they got it all figured out. Oh, here we have a person, no psychological disabilities here. It's just a matter of communication. And I think that's just kind of one of the ways, communication just seems to come up a lot in talking about access. Let's talk a little bit about why to make changes. I think we definitely all agree that there are changes that need to be made, and we all agree we're all on the same page when it comes to helping people. But we found a couple of great quotes here to help us out. One, improving service delivery to people with disabilities must become a priority because the crime victims' rights movement is founded on the premise that every crime victim deserves fundamental justice and comprehensive quality services. And this is definitely a group that we need to pay attention to. Also, in regards to current events, among just the U.S. troops returning from Iraq and Afghanistan, nearly 40% of soldiers, a third of them being Marines, and half of the National Guard members report symptoms of psychological problems. And most common is PTSD. And nearly 1 in 5 soldiers leaving the military after serving in Iraq and Afghanistan has been at least partly disabled as a result of service. One of the issues here, post-traumatic stress disorder is coming up quite a bit. Unfortunately, a number of these men and women leave the service without connecting with mental health clinics. And unfortunately, with post-traumatic stress disorder, it doesn't come up right away. It's not evident right away. It's 6 months away. It's a year away. And by that time, unfortunately, they've left a lot of the services that the military affords them, such as psychological help and working with a counselor, hospital. And this does come up quite a bit, and this number is growing, unfortunately. And I think a lot of our campuses have worked with soldiers, and we actually work with folks from Fort Riley talking about how we can help soldiers and integrating them back into classes. They want to take classes, they want to get their degrees, but working with them in what's going to help out, maybe taking evening classes when there aren't as many people here. Online classes are incredibly helpful in that regard and helping people out. But this has become a large topic and a group of people we need to pay attention to. Let's talk about strategies for reducing the consequences of violence. Let's kind of cut it off at the start before the violence happens. Things you can do. Engage the health sector in violence prevention. Mentioning it as a topic. And we talk with a lot of people on campus. Jacqueline meets with people when it comes to emergency situations. What do we do? And how can we help? But also, and what can we do just to make sure that there are those resources available? Provide mental health and social services for victims of violence. I think that's very important, and people that can respond to those situations. Improve emergency response to injuries from violence. Again, we've seen cases where a person is injured early on and symptoms don't come up until later. And I know we've talked with students who have an injury they don't think is that big, and it turns into a larger issue than it really is. And this can be sad when it happens. Reduce recidivism among perpetrators. Again, we mentioned that quote where a number of people who are victimized by the same person again later on, and that's a very unfortunate statistic. We need to be working on that, as well as improving kind of the public health model and just how we view violence and how we view people with disabilities. And then we found some strategies that we think are helpful. Increase safe, stable, and nurturing relationships between children and their parents and caregivers. It's important to have good communication with the family and family members as well as caregivers. Reduce availability and misuse of alcohol. There are a lot of programs right now that are being set up for working with people when it comes to alcohol misuse, as well as reducing access to lethal means. Improve life skills and enhance opportunities for children and youth. And I think not only for people with disabilities, but maybe children bringing awareness of disabilities in our school systems, and equality and acceptance of people in school systems. Promoting gender equality and empowering women, and making sure, I think this goes for the general population, a little bit more so with people with disabilities, but letting people know what the resources are and how we can help. Improving criminal justice systems, always a topic when it comes to national discussions. Improving social welfare systems, definitely a hot topic, especially when we're in a political season, but something to talk about. Reducing social distance between conflicting groups, promoting understanding, reducing economic inequality and concentrated poverty. If you look at those without jobs and those who make up the lower areas of our economic situations, tend to be people with disabilities. Unfortunately, the numbers when it comes to income, job loss, they tend to affect people with disabilities much more than they affect the general population.